Hello everybody, here we are, Artistic Lipo and Plastic Surgery today. I'm Dr. Su, and it's okay to use your name?
Yes, sir.
Okay, this is Hannah. Hannah, can you tell everybody where you're from?
I'm from North Carolina.
Okay, and today we're going to do multiple areas. So we've already got them marked out. We've been looking at them in the mirror, and we looked at them before, right?
Mm-hmm.
So we're going to do the tummy, we're going to do a waist area, inner thighs, and outer thighs. And we haven't done too many videos of these areas before. We've done a lot of videos, the arms and ankles and everything, they're specialty areas, but we decided, hey, let's go back to basics, okay? So Hannah is a patient that is on the small side. She's petite, and you told me that you're really into running, right?
Mm-hmm. Yeah.
So we have patients of all sizes. Hannah's one of our petite and smaller patients, but we do medium-sized patients, we do large patients. And I just want to talk a little bit about what we do and what Hannah's going to see today, which is typical of our patients. We do ultra-complete, high-definition liposuction, and that's with skin tightening, okay? Very different from what other doctors do. Our ultra-complete lipo removes about 90% of the fat in the areas that we're going to work with, and that's compared to about 50% that other doctors do. Our high definition is a very artistic approach to reveal the muscle contours below. It's also about blending the liposuction into the surrounding area so that we have any beautiful curves and contours. And it's about revealing things that you may not be able to see. On Hannah, I don't think she has any real six-pack hiding underneath there, but our liposuction is so complete that when there are muscle contours, like in the arms right here, sometimes around the ankle areas that we do, we're actually revealing the muscle contours and getting the extreme shape that we can. What about skin tightening? Well, skin tightening, believe it or not, skin tightening is like the holy grail of liposuction, because all doctors pretty much are taught that when you do liposuction on an area, that it's going to get looser and hangier. In fact, most people think that they're going to have loose skin afterwards. On some patients that could happen, and especially patients that have a lot of looseness and hanginess to begin with. But our liposuction actually leaves things looking tighter. And what we're going to see right here, Hannah's got a small bulge, okay? This is only about 3/4 of an inch thick, maybe, at the most. A lot of doctors would be afraid that, you take that she's going to have looseness and wrinkles and other things afterwards. But you'll see right afterwards, it's going to be laying flat against her tummy. You're going to get to see the nice shape. And this is something different. On our liposuction, we're going to see the shape immediately. All the nice curves and everything you're going to see, and it's going to be done right away. We do things very artistically. Hannah, I'm going to just have her turn right here. She's so thin, however, these little bulges right here almost look like a little bit squarish. And this little bulge right here is not part of her butt. It actually makes her butt look like it's sagging down a bit, although it's a very firm area. It's not sagging. So you can see when we start taking this in like this, her butt's going to look a lot rounder. When we take this in right here, her butt's going to look rounder from above. And just to show them sideways right here, this little bulge that's sticking out on her little tiny thin frame is going to be about like this. So we're going to treat everything in a way that she's going to get to appreciate this right away. Can I ask you a few questions?
Sure. Okay.
So Hannah has she's come to us from out of town. She's been following us through our videos and things on our arms and everything. So I think that's what introduced you to me, right?
Mm-hmm.
So you told me you went and visited a plastic surgeon or cosmetic surgeon in your area, right?
I did. I went to, I watched your videos for a year and finally decided this is what I wanted to do. So I went to someone local. Mm-hmm. And when I met that gentleman, even though when I said my stomach, my abdomen was my primary area of concern, without touching me, he said, oh, I think that's too small to even do an invasive measure on. I think we should try one of my non-invasive measures, my laser sculpting.
But nothing that would break the skin.
Correct.
Yeah.
Yeah.
And what about the other areas? What was the doctor going to treat the other areas?
He was going to treat the other areas, but I mean, when I come to you and say this is my primary concern, and without touching me, he says he doesn't think it's enough. And when I did the research on the laser, it said that at the best result was going to be 29%.
Yes. Yeah.
At the best result. And
29% actually means 29% reduction in the fat layer. So that's about 30% of this. That's about this much,
Yeah.
almost nothing, right?
Right.
Yeah.
And your videos say 80 to 90%
Yep.
is your goal, so to me it was no comparison.
Right. And that goes back to the generality of how other doctors do. Why do we call ours ultra complete? It's because other doctors typically only take about 50%. And it's not that unusual, you know, for someone to go, you know what, there's too little, because working in a thinner area can be difficult. And if you're working in a thinner area, you have to be very smooth. An area like this has to be very well blended. You see how we have markings out, going out, you know, to different areas? It's because if we didn't go out all to the boundaries that I've drawn out and blended in, you'd still see some kind of bulge sitting there. So you really have to have an artistic eye to do this and to do it well. You excited?
Very excited.
Okay,
Very-
so what's cool is that we may stop and do a little bit of video here with Hannah in between, maybe while we're doing it, to see how she's doing, okay? But we'll definitely do some more video in about an hour or so after we've gotten done with some of these body areas, and we'll see what she thinks as far as the pain and results and everything else. So you'll be very honest, right?
Yes, sir. Yes,
Okay,
sir.
great, thanks. So we are doing a lower crunch here now. High, feather, come in like a feather. On. Great. How you doing, Hannah?
I'm doing great.
Great. So for those of you watching out there, we're doing our trademark technique of interactive lipo. This is like gym. This is like boot camp. You see what she's doing? She is doing a lower crunch, because that gives me a hard, right, rock hard abdomen to work on. I'm not working on a water bed that's moving around on me. I'm working on a nice hard surface, and I'm controlling this fat so that I can take it super smoothly. You can come back down now. Okay. How we doing, Hannah?
Great.
How we doing, Hannah?
Great.
Great. How's it been so far?
Actually, it's been fine.
Yeah?
It really
Okay.
has.
Okay.
Good.
All right. So, yeah, we put you to the workout, right?
Yeah.
Okay. And can you already see a nice
Yeah.
difference in your tummy?
I sure can.
Okay. And we're only about halfway through. We're going to stand
Yeah.
up in just a minute, and all you guys will get to see. Okay. All right. So we'll get back into this. Heels up. Okay. Assistant. Okay. Right there. On. Okay. So why don't you come around here and take a look at her. Come around this way. Take a look at her face when we're doing this. How's it feeling?
Great.
Okay.
No, it's really not bad.
Okay.
The crunch is the hardest part.
Okay. Okay, this is liposuction. Fat is coming out. And she is doing the lower crunch here. Off. Okay, she's good off. Thank you. Okay, so for those of you watching, Hannah's getting up for the first time. We've been sculpting here, so we're going to see what her tummy looks like.
Woo!
You guys can probably see from the side. Can you let me bring your arm back so you can see nice profile. That is almost a hole-in-one. Okay, so let's turn you to the side so that you can see. Pretty
That's
nice.
Big improvement.
Big improvement. Okay, so is it as good as you thought?
Yeah, pretty good.
Okay, awesome. All right, why don't you come over on this side, Angie, and switch with me. Okay, so I'm just going to, so this is the point where we get to, you know, when we stand patients up, we get to see things that you can't see on the table. Gravity hides any waviness or lumps and bumps. And on Hannah here, I can see a tiny bit more thickness right here. And this is what we do. We mark out that little thickness that's still right there. Probably a little tiny bit as we're blending up here. And then I like to check, okay, can you see that?
Mm-hmm.
So there's just a little tiny bit more of that edge right there. We're gonna bring that down. And then you see these two little areas I marked? That's where there's hiding just a little tiny bit more fat. You can kind of see it from the sides. You turn a little bit angles like that. Okay, so we're gonna get that because we can see it.
Mm-hmm.
You would never be able to see it or know whether you're doing too much, you know, if you're just laying down. So go ahead and lay down. Don't touch anything here. We're gonna have to cleanse you again. Thank you, guys.
Mm-hmm.
Okay, I think think this is our final check, okay? Because we've done a few checks here where we saw a little bit, and we're down to just a tiny bit here. We blended it down a lot lower. So let's take a look here. How's it look?
Looks fantastic.
Okay. Yeah. So we turn right here. Just let the audience see. And you can see from the side there, right, Hannah? Can you go over to the side? Okay, that's a shape that we said we create, right? So right now we're right on muscle wall. There's not even a 1/4 inch of fat there, maybe 1/8 of an inch. Skin's nice and tight. Bend a tiny bit here. Bend a tiny bit. You see a little tiny bit. You remember beforehand we saw a lot more than that, right? So actually the skin is behaving better now. Can't say if I would call it tightening, but it sure is creasing a lot less, right? Okay.
Oh, for sure.
All right, so we're gonna lay you down, okay? How you doing today, Hannah?
Good, very good.
Okay, so for those of you out there, watching the video, we are the first day post-op. So yesterday we did our sculpting of multiple areas using the ultra complete high definition approach, and we did Hannah's tummy, we did her waist area, right? Inner thighs and outer thighs. So why don't we just turn just a little bit right here, so you can see her profile, which we showed you yesterday. Now she's completely flat. A lot of people have a little bit of swelling, and if you get lightheaded here, let us know, okay? Because some people can get lightheaded the second day. But as you can see, the incision dots are very small. She has very, very little bruising here, although there's a little bit. And do you mind turning around and just showing them the backside? So now we have this curved in waist, and yesterday she had this bulge right here and a bulge right here. So now she has a flowing hourglass, as we call it, and everything is flowing. There's a little bit of swelling in some of these areas where there's a little bit of bruising, but as you can see, the results are very immediate, and that's what we love about this. I mean, you don't have to wait weeks or months for swelling to come, down, because we see the results the very same day and next day. So how's it been for you?
Good. I'm super excited about the results.
Okay, awesome. So how was the experience yesterday as far as during the procedure?
During the procedure was good. The initial part was the hardest part.
Yeah.
And then once we got past that, it was.
And for you, I mean, I think you had some stingy, some points that were stingy, and we just added some extra numbing to those areas, right?
Yeah.
So it's not like it was without any kind of pain at all. Some people will have some stinginess that we have to address, but tolerable, right?
Yes, sir.
Okay, great. And overnight, how was it?
It was, your paperwork says that it'll get better before it gets worse, a little more intense than it did, but it was still tolerable.
Okay, wonderful. Okay, so let me take this for a second, and then Hannah, can you turn that way right there? And I'm just going to take a look. Can you put your arms up like this, and then legs a little bit apart? Okay, so everything's nice and smooth right there. Can you turn around? And what we want to see is just that she has a nice flowing shape of her entire back, and her butt actually is much shapelier, and we'll show you that photograph before and after. Okay, great. Hannah, you can turn around. And so just want to say thank you so much for being one of our first all over body videos, and we appreciate you being here.
Yes, sir. Thank you.
Okay, thank you.